a top doctor to do a life-saving examination right at your own community hospital with your family by your side.
Yeah, in the case of having a stroke, it can drastically change a person's outcome.
And now new cutting-edge technology is allowing Windham Hospital to give patients a virtual examination with a top neurologist on a computer.
Wow, take a look.
Mrs. Salitro.
Yes.
How are you?
Okay.
Tell me what happened to you.
About 2 hours ago, I noticed that I had left side weakness, and it's not getting better.
Leslie Salitro is being examined at Windham Hospital via computer by Dr. Ricardo Garcia Rivera, a stroke neurologist in Miami.
Have you ever had a stroke before? Have you ever had any kind of injury in the last few months or so, a few weeks?
No.
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 Okay. And do you smoke? Do you drink?
No.
I'm going to examine you. I just want you to do everything that I tell you to do, okay? And the nurses are going to help me when I need them to help me.
Okay.
So just relax. Tell me how old you are.
66.
Okay. And what month is it today?
June.
Very good.
When it comes to a stroke, time is brain. Thanks to new technology, Windham Hospital now has a virtual neurologist on call 24 hours a day, 7 days a week.
In rural hospitals, we do not always have all the specialists all the time that we need. So for some time-sensitive and really sick patients, rather than the patients going to where there are these neurologists, we can bring the neurologists here through current technology.
Put your hands up in front of you like if you were Superman. Very good. A little bit higher, a little bit higher, okay.
If a patient comes in with stroke symptoms, the neurologist on call can immediately look at their CAT scan electronically and, with the help of a nurse, diagnose them with a stroke exam.
Let's now try to see if she can see the same on both sides, please.
Can you see over here?
Mm-hmm.
Look straight ahead, look straight ahead. Just look straight ahead and see if she can see. There we go. Can you see her hand?
No. Yes.
Okay. You can. How about trying the right side now?
Yes.
An NIH score of 6 would designate a relatively mild stroke.
It's amazing to watch, but you feel confident you know what's happened to her.
I don't need to touch her. I just need to see what she does and see how her body works.
Dr. Garcia Rivera wants Salitro to get the clot-busting medicine TPA right away.
If we can release that clot by giving this medicine, then the blood flow is restored, oxygen and other nutrients go to that part of the brain and the brain doesn't die, and therefore function's restored.
The risks of TPA can outweigh the benefits, which is why it's often not prescribed without a neurologist. What do you think?
I think it's amazing.
And nice to know you could stay in your own community hospital.
Right.
We started this in March of this year. Our very first patient was an elderly gentleman, and there was some apprehension whether he would like the technology or not. He very much liked it. It was great to see his family also, or families of all the 28 patients we've done since March, be able to keep those family members that are able to stay here so that they have the benefit of familial influence for wellness.
Nurse Corey Roy sees the computer as another source of comfort.
And when we can tell them they can come here for something as severe as a stroke and have that neurologist right there at the bedside who's a specialist, I think it puts them a little bit at some ease. And the family members are also involved. They're right there at the bedside.
Now, if needed, a virtual neurologist can also recommend that a patient being transferred to Hartford Hospital, and LifeStar would fly them there after getting the life-saving medicine, so they don't have to waste any time fighting traffic, because again, time is brain. So for more information, we have linked Windham Hospital to our website. Pretty cool, huh?
That's really cool.
Yeah.
That's excellent. You have a specialist no matter where they are in the country.
Yeah.